Hey, Dr. Brian Anderson here. I hope that you are doing well. Today we're going to be discussing testosterone injections, more specifically subcutaneous testosterone injections. Yes, you can do them subcutaneously. As always, speak with your medical provider before stopping or starting any treatment or modifying the treatment that you're on. So for years now, we've been injecting testosterone with very large needles into the muscle. So IM testosterone injections. And with IM injections, especially if you're doing squats, if you are doing lunges, any type of leg work, and you're injecting into your quad or your glute, maybe you have found that it can be somewhat tender. So subcutaneous injections use a very small needle and inject the testosterone medication directly just into the subcutaneous fat, so not into the muscle, and for that reason it can be much more comfortable. So one of the things with injecting testosterone subcutaneously is you will probably need more than one injection per week. You would not typically inject a whole cc of testosterone into the subcutaneous space at one time. It's a lot of volume. So most people would inject 2 to 3 times per week subcutaneously. So if you were on 1 cc of testosterone per week, you would do something like 0.5 and 0.5 every 3 days apart or something like that. So we're going to go over injecting testosterone subcutaneously briefly. We're going to talk about the needle. We're going to talk about the benefits. We're going to talk about some kind of downsides. So first off, with injecting subcutaneously, you're going to be using a small needle. So that can be a 27 gauge, 29 gauge, even a 31. And the difference really between that and the intramuscular injection is the length of the needle. So you're typically not using an 1.5-inch needle with subcutaneous injections. You may use a 1/2-inch needle and or even less. So medication is not going into the muscle. You don't get the feeling of the needle pushing through the muscle. For most people, it's much more comfortable. So it's a small needle. 2 ways of doing this. One, you could draw the medication up with a small needle, and testosterone is a very thick medication, so doing so with a small gauge needle, there's a lot of resistance. It can take some time, 3 to 5 minutes to draw the testosterone up with a small needle. Alternatively, you could have a syringe setup where you use an 18 gauge needle and put the 18 gauge needle onto the syringe, draw the medicine up with a large 18 gauge, remove the 18 gauge needle, put on your subcutaneous needle, your 27 gauge by 1/2-inch or 1-inch, and then inject with the smaller needle. So you could do it that way. Or you could draw up the medication and inject with the same needle. So this is an insulin needle. Believe it or not, a lot of people use these to draw the medicine up and to do the injection with. So you don't change the needle. In fact, you can't change the needle out on these. So this is much more economical. There's less waste. You don't have to add something to the mix. You use this. So drawing the medicine up with this size needle, however, will take extra time. Injection speed and time of injection are about the same because you're using the same size needle essentially to do both types of injections. So that's the thing. The other thing that I would say, again, you probably would want to do these injections 2 to 3 times per week. So that's a downside for some folks because they're like, you know what, I don't have time to do that second and third injection. So if that's the case, you might want to stick with once a week injection. A benefit of doing subcutaneous injections is, you guessed it, it's much less painful. The other benefit is that it helps to stabilize the testosterone. So Dr. Chrysler wrote a famous testosterone replacement book, and in his book he referenced using subcutaneous injections. And in his clinical practice, he believed that it helped to stabilize the hormone levels. So with that, he believed that people were actually getting more a higher level of testosterone absorption with this rather than intramuscular. And that was based on his research. But really, one of the main things that it can do is help to stabilize hormone level. So the reason for that is you're injecting more frequently. So the testosterone doesn't peak as high and it doesn't go down as low. So that's one thing. But the other part of this is you're injecting into fat. And there's capillary refill around that injection site in fat. So with that, there tends to be a slower absorption, more steady state absorption. So that is one of the reasons why they believe that subcutaneous gives you that flat, nice flat curve is due to the fat and capillary action. So I'm going to walk you through the basics of drawing up testosterone, although this is not testosterone, with a small subcutaneous needle. And with this one, again, insulin needle. We don't change the needle out with this one, so it's all in the same needle. So the first step is obviously to take the bottle and to swab the top of the bottle very well with alcohol. That dries, we're going to take, in this case, our insulin needle, or your subcutaneous needle. Again, talk with your doctor about this, but and then that's going to go in. There is a vacuum in the bottle, so you want to push a little bit of air into the bottle to help you to be able to draw the medication out. Now, the medication can take a while to draw out because it is very thick with a small gauge needle. So just keep that in mind. It can take 3 to 5 minutes to draw up the medication. So then after that, after you've pushed the vacuum in there into the bottle, you've kind of eliminated some of the vacuum, you've got air in there, you're just going to pull slowly out. And so for this, the purposes of this demonstration, I'm going to pull to 50, which would be 0.5 cc's. And so that would be the amount of draw. So with this amount of medicine, you can imagine it's a very small amount. It's not a whole cc. So with a very small amount, it's very well tolerated. So as far as being able to administer the medicine with a smaller needle, it takes a little bit more pressure. However, you can inject this amount usually within 30 seconds using a small needle, just fine. So that's all for today on subcutaneous testosterone injections. If you have any comments or questions, please comment below. Also, please like and subscribe. I appreciate that.